Welcome back. Now, looking ahead to next month, April is National Minority Health Month, and our Toledo-Lucas County Health Department is doing what it can to reach as many people in our community as possible. This afternoon, we have with us Cheyenne. Cheyenne, say your last name again.
Nawrot.
Nawrot. See, I was going to say that, but I want to make sure she said it right.
Yes.
To talk about the importance of healthcare. Thank you so much for joining me.
Yeah, of course. Thank you for having me.
So why do we need this? Why is this month necessary? Why is this important?
So I want to first start by talking about why we have an Office on Minority Health. So racial and ethnic minority populations are disproportionately impacted by certain conditions. This is due to genetics, social and economic factors, and so we have an office dedicated to bringing awareness to those things, to those health disparities.
I think about it in terms of, well, not necessarily my family, but I know a bunch of families. Black folks don't go to the doctor.
They don't. It's for a multitude of reasons. I think that what I'm looking at now is people just don't feel comfortable. They've been made to, maybe feel a certain way when they go to the doctor, just because it may be like being on Medicaid, or maybe they haven't been to the doctor in a long time. So it's important that we have, healthcare systems that are culturally competent and sensitive to what the people that are seeing them are going through.
So when it comes to me going, do I need to be going at a certain time, a certain day? I know the office is set up. What's going on?
So are we talking about in terms of like going to the doctor? So it just is going to depend on what you need, like, what your needs are and what you need addressed by the doctor. You might have to, see a specialist or something like that. So, and who takes your insurance and all those things like that. So those factors can be pretty daunting to try and figure out for people. So I think that is why some people maybe shy away from not going.
I know you've got events coming up.
Yeah.
Tell me about them.
So Minority Health Month happens every April, and it's really just a opportunity to really highlight and bring awareness to those health disparities. So there's events going on that are bringing awareness to cardiovascular disease, diabetes, infant mortality, lots of other things, access to care and barriers to accessing healthcare. So it's really, like I said, a chance to just shine the light on those and highlight those grassroots organizations in the community that are doing the work. And I do want to say that just because, Minority Health Month is very important. Like I said, it happens every year. We make sure that we do events in the local office and are involved in the community. But the Office on Minority Health at the Toledo-Lucas County Health Department and lots of community agencies are doing this work all the time. So I think it's important to note that, that there's events like this that are constantly going on.
It's not just, so while the month is here to highlight and definitely bring awareness, understand that we always here, we can always help.
Yes, there's always help. And so my office is very unique in the way that I don't necessarily deliver a certain service, but I am here to report on the health status of minorities in the community. I'm here to inform, educate, and empower, really mobilize the community partnerships, so getting with them to put on events, to bring awareness to any topic or bring resources to a community, and then also advocate for policy and initiatives, related to minority health.
Now, while opening day is tomorrow, again, April, so it's almost tomorrow when you've got your events going on.
Yeah.
What can I look forward to? When are these events? And then who's allowed to come? So
I first want to say that any event that the Toledo Office on Minority Health and the community partners put on, we always want to make sure that it is open to everyone, free to the public. You just need to show up and, take advantage of the things that are there for you. So our first event is happening April 11th. That's a Thursday. It's at Camp Branch Library from 11 to 2. That is going to be centered around the experience that Black mothers have with postpartum depression. So we are going to have a local counseling agency there. It's called Blessings in Disguise. Jasmine Pope is the founder and lead therapist. She is doing a discussion on that. We really just hope that it is a safe space to have that dialogue for moms who may be experiencing postpartum depression or are currently pregnant and maybe don't know a whole lot about it. So just like I said, having a safe space, kind of intimate environment for them to come talk, share their stories, have a light lunch, get some resources that they need. And then the next event that we're having is Saturday, April 20th. That's at Wayman Palmer YMCA. That is a very big community-wide event. There's going to be lots of resources in the building for behavioral health needs, community health clinics, things like that. We will have bouncy houses. What else? Sorry.
Food?
Food, yes. Thank you for reminding me. I just needed a little bit of a reminder about what we had going on. So I always want to feed people. So we're going to have food at the event. We'll have an opportunity for kids to participate and make some healthy snacks. We're going to have some exercise classes going on. And like I said, bouncy house, rock climbing walkers and Metro Parks will be there with us.
Nice.
A DJ outside. It's just going to be a very fun event for children and families to come and get a better look at the resources we have in Toledo, and then just have some fun.
Nothing sounds stuffy or intensely serious. I know sometimes when folks think, especially if they're afraid, they think, oh, well, if I go to the doctor immediately, I die the next day. That's clearly not true. That's not it. Obviously, negative experiences can color things, but we want you to get help.
Absolutely, and that's why we have offices like mine, and why I try to really partner with community organizations that have the same mission that we do at the Office on Minority Health. So we know it can be scary. We know there's lots of reasons why people just don't go to the doctor. So we're here to empower people and also have the conversation with you. So, you know, what's maybe plaguing you about not going to the doctor, and maybe even give you some kind of tips on how you can approach your doctor, or questions that you can ask so you can just take control of your health.
Cheyenne, thank you so much for taking the time.
Thank you. I
have these
appreciate it.
options. You hear about it. It's all next month.
Yep.
We will be right back.
Thank you.